Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. As always, I'm so excited to present who we've got for you today. We've got a bunch of really great expertise. Because our conversation was so great last week, we're going to bring back the HERC. So we've got Dr. Upholz here to talk to us about the HERC, and we've got Blair Warren and Dr. Sadler to talk to us all about the HERC, and we're going to get into that too. We're going to start by talking a little bit about the heat that we're experiencing and where you can access cooling centers. So we've got Ashley Herbig from the health department here to talk to us a little bit about where we can access those cooling centers. So thank you so much.
Thank you for having me. So at this time, everybody is aware that it is incredibly hot outside. So we need to make sure we take our safety precautions and stay cool, stay indoors if we can. If we don't have access to that kind of reprieve in our own homes, our local organizations are offering a reprieve for the heat. This includes Carriage Town Ministries, Center for Hope, or Catholic Charities, as many know it as, and the North End Soup Kitchen. All of them are offering a cool place to stay with hydration within their normal operating hours, as well as our local senior centers. So all of our senior centers are offering some shelter from the heat, some cooling up, abilities, as well as hydration at all of our senior centers, except for Losay Senior Center down in Fenton. That one is still operating as a normal senior center. There is no reprieve for the heat there. We are also working with our outreach partners, Street and Path Outreach. What they do typically on a normal day is they do canvass the streets and hand out food for individuals that they see may need that help. Right now they're beefing it up a little bit, and they're handing out water too for those that are out there that look like they could use some cold water just to help stay cool in the heat. This is always a work in progress with the health department. We are always working with our local partners, our shelters, our soup kitchens, the Red Cross, emergency management, and our outreach partners. We want to make sure that we have everything up to date and ready to go, just so that when we do experience these extreme weathers, events, that we are ready to go in the heat, the cold, severe storms, you name it.
One of the things I really love about the, I'm not muted, okay. One of the things I really love is the opportunity to bridge community resource with sort of data that we know. And Dick is going to talk a little bit about green space and how that contributes to having safe environments that aren't like overheated. I wonder if you talk a little bit about like what symptoms people should be thinking about as heat exhaustion or being overheated, and maybe we can talk a little bit about what people should do if they experience those symptoms.
Me, right?
Yes, sorry. Sorry.
Yeah, no, you're okay. It broke up a little bit, so I was like, I think that she's ready for me. Yeah. So what we're looking for as far as heat-related illness is what they classify it with the CDC. We're looking for symptoms for heat stroke, such as high body temperature, hot and red skin, strong pulse, headaches, dizziness, nausea, confusion, loss of consciousness. These are all very serious symptoms for heat stroke that if anybody is experiencing those, they need to call 911 or go to their local emergency room. We need to move that person to a cooler place and get that temperature down. Same with heat exhaustion. We're looking for heavy sweating, cold and pale clammy skin, fast weak pulse, nausea, vomiting, muscle cramps. Again, we need to loosen our clothes, take a cool wet washcloth, move to a cooler place if possible. If not, definitely get medical help so that we don't slide into that heat stroke area. We're also looking for heat cramps, excessive sweating during intense exercise, muscle pain, or spasms. We do not recommend anybody doing any very strenuous physical activity outside, especially when it's about 100 degrees outside. It's just not ideal. You are definitely putting yourself at risk for a number of things. And this includes a sunburn and a heat rash, small blisters on the skin. Again, if we're experiencing these, our first and foremost opportunity we should be taking is going to a cooler place, trying to get our body temperature down, drinking lots of water, getting a cold, wet washcloth, wearing loose fitting, breathable clothing, just making sure that we are being mindful of what we're experiencing and making sure that we are getting the medical help we need if it's gone into the heat exhaustion and heat stroke territory.
I'm looking at these locations, right? And you've hit a couple of senior centers, and I wondered if you talk a little bit about why the elderly population is sort of what the health department has targeted to be really thoughtful about.
So our elderly population, as well as our children too. I know the Burton Senior Center is offering reprieve for anybody, no age restrictions whatsoever. Some of our senior centers will say 50 and up. Burton Senior Center says anybody, come one, come all. We want to make sure that our younger and our older population are taken care of in these extreme weather circumstances. Their bodies are not going to be as apt at regulating and staying within a safe place, especially if they're outside doing any physical activities or any strenuous activities. We need to make sure that we're more mindful of the fact that their bodies may need a little more help than, say, you or I.
This is such important information. I really appreciate you presenting this and telling us the locations that people can find reprieve. It also looks like we're targeting and making sure resources are available for our populations experiencing homelessness.
Absolutely. Anybody that is displaced in any way, shape, or form, we want to make sure that they always have the information for those resources. Typically, our outreach for our displaced populations is pretty good. You know, we're definitely going out there and we're making an extreme effort to get to them and make sure that they have a trusted, safe place that they can go to get the help that they need if they need it. The same goes for just in general individuals who may just not have access to a cooling system in their house or whatever their circumstance may be. It is not a be-all, end-all. Everyone is welcome to use these resources to make sure that they stay safe during these events.
Ashley, I really appreciate you and all of your resources at the health department. Thank you so much for taking a moment to share with us the cooling resources that are available to people in this heat.
Absolutely. Again, thank you for having me.
Yes, absolutely. So we're going to follow up a conversation about people who are doing really great job, you know, providing resources to the community with understanding where we could do a better job of providing resources to the community and maybe bridging some gaps. And I'm going to ask Heatherlyn to get right into the health equity report card.
Super. Thanks, EJ. You know, we started this conversation last week and ran out of time.
We did, but you could never put us three on a Zoom and a webinar.
Right. Well, and here's the thing, we're in trouble this time because we invited Blair, we invited Dick, and now we're adding Dr. G. So you're going to have to rein us in because I want to make sure that we save enough time to get to the latter part of the webinar, but we're so grateful to get to talk about this piece and really dig into the data. But I want to just recap, just in case you weren't able to join us last week. Number one, you can go back as always and visit our YouTube channel and hear, you know, kind of the background story to the Health Equity Report Card or the HERC. But just to recap, we created the Health Equity Report Card to share health outcome data with our community. But it's not just health outcome data. It's disaggregated or it's broken down, so that we have data for 51 different indicators that are broken down by location, Flint, Genesee County, Michigan, and the United States, as well as by race in a comparison of our Black and white population. And we're using a report card format because we think that that's going to make the information easier to understand. And here's why the HERC is so important. It helps us to support existing prevention and intervention activities and also address the causes of the disparities, those inequities that are present in our community. So let's jump in. What we've done is identified a way to categorize those disparities. And just recall that a disparity is a significant unfair difference. And that's how we're defining it throughout the HERC. And how we figured out the disparity ratio is that that's a measure of the difference in outcomes between two groups, whether it's between two geographic groups or between two races. And another reminder, just because there's a lack of disparity. Just because you see an A or a B, it doesn't mean that there are adequate health services, access, behaviors, or outcomes. That just tells us the difference. So that's a taste of the background. Again, go back to the YouTube channel if you want a little bit more information, or reach out to us. We'll always talk about the HERC. But let's jump into the data. And Blair Warren, who you met last week, is going to walk us through how do you access the HERC, where do you go, and what will you find when you get there?
Cool, awesome. Yeah, thank you guys for indulging us more and letting us talk more about this and get more into what the data is really telling us. So in order to find it, you can go to flintresearch.org and there's a health equity report card section. So you click that and that'll take you into the health equity report card. And there's an introduction and all that kind of stuff that we've already discussed and explained a bit, but you can learn more about that here. But really, to go into the data, you can either click on the category pages and navigate that way, or you can download the PDF and just have it all in one PDF format as well. So essentially, if you want to hear more about the background and everything, you can go to the YouTube video from last week. But essentially, starting with health services and access, some key takeaways are that disparity is present between Genesee County and Michigan residents for cost-prevented care and the percent of the population that is uninsured, with Genesee County residents facing worse outcomes. And then when you look at the data by race, racial disparity in Genesee County and Flint varies across the health service and access indicators, but racial disparity is present in Genesee County for cost-prevented care, preventable hospital stays, with Black individuals facing worse outcomes. So that's something of note for health services and access, and something to monitor and may require intervention. Going forward, each of the categories have maps related to that category. So here we have a map of Genesee County showing the data for lacking health insurance access. So you can kind of see what that looks like in the context of Genesee County as a whole. And then in the next category, there's socioeconomic status. And overall, individuals in the city of Flint experience worse socioeconomic status indicators compared to individuals living in Genesee County as a whole. But areas of particular concern are poverty and unemployment, which definitely require intervention. And this is all based on that disparity ratio and the letter grade that is associated with it. And then by race, interventions are needed across all socioeconomic indicators in Genesee County for racial disparity, and especially for poverty and unemployment. So those are of note, but their interventions are needed across all of these indicators. And then for socioeconomic status, we have a map for socioeconomic distress here, so you can get more context and make sense of the this issue based on the map here. And then for physical health, overall, there's little or no disparity in Genesee County and Flint for physical health, but there is a lack of data for Flint regarding physical health. So that's something where, you know, we'd either need to find more data, get access to data that is being collected, that kind of thing, because lack of data does not mean lack of disparity. And then by race, a similar issue, but of note, racial disparity is present in Genesee County for binge drinking, with the white population facing worse outcomes. And then for physical health, we mapped poor physical health in Genesee County here. For mental health, we've looked at a few indicators. We definitely would love to expand this more with more mental health related indicators, but disparity is present between Genesee County and Michigan residents for suicides by firearm, with Genesee County facing worse outcomes. And then by race, there's racial disparity present for suicides in Genesee County and suicides by firearm in Flint, with the white population facing worse outcomes. And then here we mapped poor mental health for that mental health category. Maternal and child health, this is a huge one. There is disparity present between Genesee County and Michigan residents for teenage births. There's also disparity present for children in poverty and infant mortality, with Flint residents facing worse outcomes. And then when we go to it by race, in Genesee County, interventions are needed to address racial disparity across all 6 maternal and child health indicators. Particularly children in poverty, child mortality, infant mortality, low birth weight babies, and teenage births. And additional data would be needed as well to create a fuller picture of this category also.
And this really is one of the ones that stand out. When you look at the 6 different categories, this and then health outcomes are the 2 that really where we really need to be keying in on these particular indicators. And Blair noted that, this is only a taste, right? So the HERC includes data that are publicly accessible from the census, the CDC, a variety of different locations. They're all listed at the end of the HERC, so you can find those out. But getting back to our maternal and child health here, we're just, we suspect just getting a taste of what we're actually seeing in the community. Mm-hmm. And so what we hope is that as others see this information, if you have data or have access to other data, send it to us. We would love to include it in the HERC. And also just a reminder to folks, we included this narrative at the bottom of the page so that folks can just grab it, grab the images, grab the language, and use it. Use it as a part of your annual reports. If you're applying for funding to support your efforts or new interventions that you want to do, mm-hmm. Grab it, use it. That really is one of the purposes of the report card. And Dr. G, I know I saw you join. If you
I saw Dr. G too.
So join in. Certainly you're seeing many of these outcomes in the community as well, because you're boots on the ground and seeing much of this. So feel free to join in as well. And EJ too. As you deal with folks experiencing these outcomes.
I mean, I'm curious to see what Dr. G is seeing in the community and the community perception of some of these, right? Like if the data that you're seeing in terms of the poor report card data on maternal and child health, if that is consistent with sort of what our community members feel the experience is. It's certainly consistent with sort of the research that we're trying to do in public health, right? We've got a bunch of resources and researchers dedicated to really thinking about this, right? So when we think about particularly maternal mental health and maternal mortality, we've had people like Jennifer Johnson come on and talk about the work that they're doing. We've had people like Janae McCoy-White come talk about the Hear Her initiative, right? All of which is dedicated towards moving some of these metrics. As we think about child health, we think about the Kids RX program that has gotten a little bit of movement with Dr. Mona and her work. So certainly the work is dedicated and there's some recognition around this being an area that we need to target. But I'm really curious about the community perception and what we're seeing on the ground.
Unfortunately, we lost Dr. G.
Did we lose Dr. G?
I know we did. And I'm just watching. I think she's joined, but I don't think she has audio quite yet.
No, okay.
Well, we will stick a pin in this because this really is one of the other reasons why we did the HERC is to start these conversations.
Absolutely.
Like 7 dimensions of maternal and child health. And we know that there are far more areas and far more indicators that we need to be including.
But part of what it highlights, Heatherlyn, is this idea of what community academic partnerships look like, right? So we have an opportunity. You've done this great work in combination with Blair and Dick, and you've done this great work to sort of ascertain what are the areas that we need to work with community and leverage the resources that already exist to be thoughtful about closing some of these gaps, right? So starting with the health department, we know there are health department resources that we could be leveraging, but understanding sort of where the gaps are and where the opportunities are for collaboration feels like a really important part of that discussion.
Yes, yep, definitely. Blair, keep us on track. So keep us going, because I
Yeah.
make sure that we.
I'm glad we took a pause with maternal and child health, because this is a major one and a lot of disparity here. And then moving forward, we mapped single women births for maternal and child health to give a picture of that. And then for health outcomes, that's our final category. We have a lot of indicators for this. So, for example, this is split onto 2 pages here. So this is by location. As you can see, diabetes mortality and homicides by firearm are the major points of disparity for health outcomes by location. So these have Genesee County facing worse outcomes overall, except homicides by firearm. The other populations face worse outcomes compared to Genesee County, but overall, Genesee County is facing worse outcomes for diabetes mortality and homicides, as well as for years of potential life loss. Flint is facing worse outcomes as compared to Genesee County.
And real quick, sorry, one last thing. We would have loved to have done a comparison between Flint and Genesee County, but we had to opt for Genesee County and Flint. Note the differences there, because we just didn't have enough data for Flint yet. So we're hoping, at some point we'll have access to that, or it'll be collected. Come on, EJ, what are you gonna say?
I want you to explain those differences. Like, tell us what that means.
Yeah. So Blair, go ahead, because you led the charge on this.
Sure. Yeah. So for example, for homicides by firearm, or we'll do homicides. So it's a D-level disparity here between Genesee County and Michigan. And as you can see, there's an asterisk there. An asterisk indicates that Genesee County is facing worse outcomes. So that means that Genesee County is facing worse outcomes as compared to Michigan as a whole for homicides. And that's a D-level disparity. So it's a quite a large disparity, where there are far significantly more homicides in Genesee County as compared to Michigan as a whole. So like the rate of homicides is much higher in Genesee County. I said that a few different ways. Hopefully that is clear.
And we would have loved to have done Flint and Michigan, Flint and the US, but we didn't have enough data to do that across all 51 indicators throughout all 6 categories.
And I'm guessing because your number was smaller, right? Like Genesee gets like at all of Flint, Grand Blanc, all of those places, but your number was smaller for Flint and you just didn't have the data.
Exactly.
Yeah. So we were able to have data for Genesee County for all of these indicators, but not for Flint. So only for some of the indicators we have data for Flint. But because of that, we focus the comparison on Genesee County as compared to other locations, instead of Flint as compared to other locations, just to have a fuller picture. But we would like to have more specific honed into Flint. This is just a call to action for anyone who has data.
No, really, because what you're saying is, Genesee County gets us a bigger pool, the demographics are different, right? But when we go to look at Flint and we don't have that data, that in and of itself is a disparity of sorts, right? And it's something we need to address and think about. So I really appreciate that point.
Yeah, definitely. And then looking at it by race for health outcomes, you'll see there's similar points of disparity. So diabetes mortality is still an issue, a racial disparity for Genesee County and Flint, and same with homicides and homicides by firearm. And the disparity is actually even worse when looking at it by race. So these, this is just kind of a high level look at all of this, but there's a lot to talk about here. We could talk about this all day. And each point we could talk about even more, but key points are definitely, homicides and diabetes mortality for health outcomes are things to look into and require intervention for sure. And then we have life expectancy here mapped. It's kind of another picture at health outcomes for Genesee County.
And taking us through the rest of the health equity report card here, we've got our glossary, just to remind folks, these terms are kind of peppered throughout the HERC, but they are located at the end as well for easy reference. And then of course, we want to acknowledge our partners who have been absolutely amazing, including the Community Foundation Greater Flint, the Health Department, the the Greater Flint Health Coalition, and then our funders as well. So don't forget, you can always access the health equity report card on our website, which is flintresearch.org. But there also are some really amazing resources as well through the Greater Flint Health Coalition and their community health needs assessment. The State of Flint Kids you can find as well, and then the North Flint Community Dashboard, which is a part of the Ruth Mott Foundation. Thanks to our partners, and thanks for the chance to talk about the health equity report card.
Thank you so much. I love that this discussion today is really all things health equity, right? Because Dick, you're going to talk to us a little bit about nature is nurture and what green space means for the Flint community and what that means in terms of health equity outcomes. So super appreciate you and our assistant professor Sam's expertise in talking to us a little bit about what this means.
Yeah, for sure. And thank you for the opportunity to talk about this. We also have our special guests, Raynetta and Cade, who are going to be kind of Q&Aing with in the middle of this. And so if we run out of time, we'll hack off the second part of what Sam and I are going to talk about. But, we know there's a lot of public health issues in the community. And so sometimes thinking about the benefits of green space and nature can be secondary to what we think are the immediate pressing challenges. But one thing that we're going to learn is that fundamentally, when people are exposed to more good green space and less bad green space, as we know we have a lot of here in the community, the pathways to health can kind of be made smoother. So yeah, that's what we're going to talk about. And I'm not going to carry on about this, but we know that there's a lot of reasons why we have a ton of vacant property in Flint. We went through not only deindustrialization, but decades of state-sponsored white flight, structural racism, property abandonment. And so even before General Motors ever started pulling out of the city, we had thousands of homes that had been vacated and the population of the city was declining. We've been a very pro-suburban state for many decades, and that's at the expense of our cities. So the net effect of that is that we wind up having extra land. If we compare that to other places, if you could imagine, what the UK looks like, right? The cities are denser. If there's a vacant property, the odds are it gets redeveloped as something taller and denser within a few years. And there's certainly outliers, but go to Japan. Even Japan's population is declining, but their society manages vacant property much more effectively. They have certain rules around where you can build new property, what can be built, and how vacant properties are managed when they come online. And so the scholarship around this topic varies substantially from one country to the next. And say even consider Ghana, massively growing cities across West Africa. There's much less vacant land, and the planning process may be struggling to keep up with the pace of population growth. But here in Flint, we have population decline and a pretty bad urban planning system, if I'm frank. And so that creates this mess where we have all this vacant land in what should be the densest part of the county. And so we'll talk a little bit more about the outlook of what we could expect from this, but the kind of the directions that scholars are taking and that community-based research is taking is that we're trying to figure out, how does this impact people? How does the presence of unmaintained vacant land impact people? How can we maintain it in a way that benefits people? And then ultimately, how can we either get this property back online in some kind of use, whether it's housing or recreation or commerce or industry, or at least how do we minimize the potential negative impacts?
Yeah, and just reiterating here what Dick said, we're here to really talk about why all of this vacant lots in Flint really matter, how they're potentially adverse for health, but also how they represent a variety of opportunities to transform the land, to take it from being a potentially blighted space with adverse or negative health effects and turn it into a space that can deliver and unlock all of these health promotion benefits. So we're going to start, I think, by talking about kind of the bad, what vacant lots in sort of dilapidated or blighted forms can represent and how they affect health.
Yeah, and so again, if you've been around Flint, you probably have a sense of your own of why this matters, but we know that unmaintained lots often invite more dumping, and we may hear a little bit about that from Raynetta in a few minutes. And dumping is not just litter, right? It's contractor waste, mattresses, couches, big stuff that invites rodents and mold and makes it unpleasant to live there. And so these properties often wind up impacting mental health, because if you can imagine living next to a vacant property or 10 vacant properties, or being the only house left on your block surrounded by vacant, I shouldn't say vacant properties, but abandoned houses, right? Because there's that distinction too. And so the process of neighborhoods going from occupied homes to a bunch of abandoned homes to eventually being demolished and becoming vacant properties, and then those properties either being maintained or not, there's a lot of kind of different points in that chain where it requires some kind of intervention, right? And these neighborhoods that have a lot of vacant property can also invite crime. They can invite people occupying those houses before the houses are demolished. And then even after the houses are demolished, they can become sites where people might congregate, again, depending on how those spaces are maintained. And then there's also an economic and a connected health question when we lose population and places that used to have tax-paying homes on the blocks and customers to the neighborhood corner stores and everything, and kids in the schools and people in businesses, and your community evaporates. And so it becomes a reinforcing, like a bad positive feedback loop where things just get worse and worse.
Yeah, and like we said, the beauty is there's also a lot of potential opportunities to take vacant lots and to take other forms of green space and transform them so that they can offer all kinds of different benefits. So I want to just take a second here and talk about some of the main pathways or the main connections we see as researchers, as community-based researchers, between high quality green spaces and health. And there are really three main domains or pathways. They're psychological pathways, behavioral pathways, and ecological or environmental pathways. So starting with psychological pathways, green spaces that are well designed and maintained have a potential to really restore your psychological state. So if you're feeling stressed, if you're feeling cognitively or mentally fatigued, and you enter a green space, or even if you just look at trees or other kinds of green space, even if it's virtual or even for just a short period of time, these kinds of green spaces have the potential to reduce stress, to reduce attention fatigue, to give you more energy, to enhance attention, and all kinds of sort of psychologically restorative effects. The next major domain or type of benefit of green space is its ability to promote healthy behaviors. So green space, one of the largest behaviors that's studied in relation to green space is physical activity. And that makes sense, right? Because green spaces provide a venue for exercise. It can be exercise that's recreational, like Dick and I are going to go to the park and we're going to go run around a lap in the park. Or it can be what's called utilitarian physical activity, which is when greener neighborhoods or street trees and other forms of green space just make the environment more aesthetically pleasing. And that encourages people to get outside and commute to work by walking or by cycling instead of just automatically getting in the car because, well, it wouldn't be a very nice walk or bike ride if you're just kind of in a concrete jungle. So green space has that potential to just increase utilitarian physical activity. And lastly, green spaces provide an amazing space for neighbors and friends to get together, to enhance social ties, to create new connections. And those kinds of social capital or social cohesion are really, really important for longevity. And there's a lot of research showing just the incredibly important nature of having social connections for living a long and healthy life. And lastly, green spaces offer a whole bunch of different ecological benefits, or what are often referred to as ecosystem services. So this includes things like improving the quality of air and water by removing pollutants, also providing, like we were talking about earlier with the cooling centers, green spaces really have the potential to lower surface and air temperatures, both through providing shade and through a process known as evapotranspiration, which I can't say that one again, but it's a combination of evaporation and transpiration. And it just reduces the temperature in the air and then on the ground. So just for example, in the peak summer months, a shaded area by a tree is up to 45 degrees cooler than an unshaded area, if you can imagine. I mean, that's a massive difference. So all of these benefits that we've talked about here, the psychological, the behavioral, and the ecological, they can all potentially be achieved through things like restoration of vacant lots. So we have Renetta next, who's going to talk a little bit about some vacant lot programs and other things that she's working on with the Genesee County Land Bank.
Yeah, and Renetta, I was thinking we could kind of do this a little bit Q&A style. Especially so, just so folks know, I once upon a time worked with Renetta at the land bank. I was an intern for one of the programs at the land bank, and so I was hoping maybe we could just have a kind of a back and forth a little bit. I'm going to bring you front and center on my screen so I can see you a little better. And so tell us, you know, how long have you been with the land bank? What has been your role there? There you go.
Can you hear me now? I think
Yeah.
so. Okay. Well, actually, Rick, I've been with the land bank in one way or the other since the beginning, which is in 2004, because I was one of the original board of directors. But I've been working with the land bank for the last 14 years. I think I started in 2009.
Super. And wasn't it? So tell us about the Clean and Green program. Was that founded before that time? Before 2009?
You know what? The Clean and Green program started the same time the land bank was established. So it's been in place since 2004.
And that was a community initiated program, is that right?
That is correct. It's a community-based program.
And
It
so
provides.
oh, you go ahead, yeah, please.
No, you go ahead. Go ahead.
Oh. But the community really knew some of the benefits of well-maintained vacant property, and they understood. I mean, of course we understand stuff like that, right? Like there's certain things that researchers can study and can add understanding to, but fundamentally there were community partners saying, you know, these unmaintained vacant lots are awful, you know, that having the experience of living next to them for 30 years.
If my memory is serving me correctly, I think it was Harry Ryan that was having a conversation with Dan Kildee about the vacant lots in his neighborhood. Now, I can't really recall if the Clean and Green was established because of that conversation, or if it was the Citizens Advisory Council that was established. But I know Harry was really concerned about the vacant lots in his neighborhood and was constantly talking to Dan about this challenge. So.
And that was the Piper Green Corps, right? Kind of.
That's correct.
Yeah,
you have a good memory. Yeah, that is correct.
And you had said, you and I were chatting last week, there was another core partner. Was it Barb Griffith Wilson? Was it she another on the south side, right?
Right, on the south side. And I can't recall. I think it was, well, I'm not sure. It might have been, her group might have been Brennan Park, but I'm not sure. I know that's what it is now. Yeah. So I don't know if they changed names after she had passed.
Yeah, but and I think it's an interesting commentary too on our patterns of disinvestment in our community, that they represented two neighborhoods that had been, you know, solid, well-populated neighborhoods through the 40s, 50s, 60s, but that experienced a ton of deliberate disinvestment and depopulation. And so wound up, you know, those neighbors wound up the ones having to deal with that kind of neighborhood intervention, just in order to live in a decent neighborhood.
Right.
Yeah.
So,
so how many groups participate now?
Right now, we have 66 groups participating,
Wow.
And
which is a huge difference between since the beginning.
yeah, and I know because I'm in one of those groups, and so I use the Flint property portal. And for folks who may not
Excuse me.
know, and I'm going to be silly and show this to the camera, but the Flint property portal shows you all of the clean and green groups, and you can zoom in and see all of the lots that are being mowed every 3 weeks by hundreds of community volunteers.
So let me put a number to that,
Yeah.
Rick. There's every 3 weeks, and this is last year's stats, every 3 weeks, 3,600 lots are being managed by our clean and green groups.
Nice.
And I think last year we had 65 groups participating, or 64. So
Okay.
65 this year, 64 last year.
Yeah, and that's basically citywide, because now, we're in nearly every neighborhood in the city, we're experiencing some issues with blight.
Correct. We have a huge inventory. We're close to 15,000 properties
Mhm.
in our inventory. 9,000 of those properties are vacant lots.
Mhm.
And that's not solely Flint, but of course, with Flint being the largest city in Genesee County, most of the properties are in the city of Flint. So
Right.
we have groups covering not all of the city, but the city of Flint. And we have a couple of groups that go outside the city of Flint. We have a group in Beecher and a group in Burton.
Oh, okay. Yeah. And it's Genesee County's land bank was the first. Was the first land bank in the country? Is that right?
Yep, we're the model for the country.
Yeah.
So we have a lot to be proud of.
Yeah, and so it means, a lot of the ways that we have to deal with vacant land, we have so much more than a lot of other cities of our size. It's just such a massive magnitude of work that the land bank crews and the clean and green groups put in every summer, right?
That's correct. But Rick, if I could, we also have other programs that help manage
Okay.
the vacant properties that we have in our inventory. So
Mhm.
we have the adopt a lot, where residents can adopt a lot, a yearly adoption. We also have a side lot program where any resident living next door, where their property is touching a vacant lot that's in our inventory, they can purchase that lot under the side lot program in the city of Flint. And most of the times it's $100 or less. And then we have a lease a lot program where individuals can lease a lot anywhere from 2 to 5 years for $1 a year.
Nice.
And then we have our fabulous demolition program. So
Yeah.
we can talk about that if you want to, but yeah.
Sure. Yeah. How many homes are going to be demoed in the next few years under this new funding?
2,000, about 2,000. So we were able to get $43.7 million for demolition, which is all of our demolition programs have been aggressive because we just came out of HHF. And before then, I think it was NSP, Neighborhood Stabilization. I think we had a demolition program under NSP. But yeah, HHF, and now we're doing another aggressive demolition program. So far, we have, as of today, I think about 150 residential structures demolished.
Yeah. I've already seen them in the neighborhood where I mow on the south side, and it makes such a difference. And especially knowing that you often will plant clover now, so the way that these grow back, it's a slower growth. It's easier to maintain these properties.
Right.
I'm gonna wrap us there and segue over to Cade, but I think that the land bank, because they've had to be a leader in so many of these areas, it's just a massive amount of work, and I think that they don't get enough kudos. So I just wanted to send some thanks to everything the land bank's doing, and likewise, segueing over to Cade. So I know, Cade, that not all the work you do is green space related, but I wanted to have you on here and certainly to the extent that your work does focus on that, I wanted to chat a bit about that. But folks may know that the CRIM has a foot race, that we follow that blue line every summer. And maybe they know that the CRIM's in schools, but there may be folks who don't know the work that you do in healthy communities. So hoping that you could kind of open with sharing some of that big picture stuff that you do.
Sure, yeah. Thanks for inviting me to do that. So as Dick said, the CRIM has been around for, this is our 46th year of doing our August race series, and understandably, I think most people around Flint and Genesee County and far beyond know us for that and all the wonderful energy and excitement and tradition that goes along with that. But really, within just a few years, right, of the race itself starting, the CRIM started building additional kind of programming and classes and lessons and creating training groups and stuff, still all around the idea of that race, but creating an ecosystem and a staff that was really good at kind of building almost individual capacities to be able to do this one very prescriptive kind of health thing, which was running 10 miles, on the hottest day of the year. And then over the course of, a couple of decades, as the group got more sophisticated and just kind of taking a look, we realized that we had this big platform with this huge constituency that was really into this event. Realized that we had more power to make a bigger difference in this world of health, and B, that the public health outcomes, as we all just sort of saw in that report card, right? But this was back in the 80s and 90s, this was first really being examined, that the differences between the county and the city itself were pretty dire, and just we weren't okay with that. So fast forward a little bit further, the CRIM created, it's been a number of different departments at this point, but really started to take on the idea of looking at Flint's systems, our policies, and our built environment, and the effects that those had on those discrepancies between health outcomes in those two areas. And that's really when they brought me on. And that was back in 2013 when I first started working with the CRIM. And since then have had a number of kind of roles, but all centered around using the tools of urban planning and design as methods to improving public health here within the city of Flint. And now I'm happy to be the director of urban strategy for the organization, and housed within our dedicated neighborhood impact team, which has kind of our in-house urban planning experts and educators, but also a lot of awesome people who are really skilled at channeling kind of state and federal resources that often really were built with that same kind of personal intervention ethos that the initial kind of CRIM programming was designed for back in the 70s and 80s. The idea of like, we can teach one person how to make a different decision around what they eat or how they move around their neighborhood or whatever. We were really good at taking those, but then twisting them around and reinterpreting them in a way that can be really applicable on a neighborhood level. And we truly see like the neighborhood unit as the most effective kind of the smallest and most effective unit for these like sort of big citywide changes that we really want to help facilitate. So that's kind of what the CRIM's, as general as possible, like what the CRIM is kind of doing in this field. And then with the ways that it intersects with vacant land and blight and vacant properties as well, as you stated, these exist all throughout our city and county. Really no neighborhood is immune, but certainly some neighborhoods have been far more affected and have been affected for a much longer time than others. And we do a number of things, right, to build into our conversations around walking and biking to school, or accessing healthy and locally grown foods, right, within neighborhood context. So we almost, really honestly, without a doubt, there's always some element of vacant space that has to be a part of that conversation. Some things you already referenced, where some folks absolutely say they don't walk a certain way, or maybe don't even walk at all because there's land or a building within their neighborhood context that is upsetting or scary, or acts in some way as a barrier. Or on the opposite side of that, maybe they don't walk to a school or grocery store because that school or grocery store is now a vacant lot, right? It's not a thing that's even there anymore. So kind of all sides of that equation. And the last bit of thing I'll say is that something we've really been trying to do, especially in recent years, is when we're working with neighborhoods on creating plans and having deeper discussions about land use and transportation policy and how they actually can move forward. Trying to expand, the list of options and ideas for how vacant lots and vacant properties can be used. So knowing that all the things that Renata shared, the idea of adopting a lot or demolishing or rehabbing, those are all great options, but that there's also so many more options, right? If we have sort of broad ownership of our neighborhood properties, and this weird asset, right? These assets of all this vacant land that we can make more decisions with, helping people sort of see more options of what's available and how that could possibly affect their health and well-being in all the ways that Sam described earlier.
Mm-hmm. Did you have a question?
Oh, no, that was great.
Yeah. I'm thinking of a couple of the examples of projects that I know that you've been responsible for or had a hand in the past. What's one physical intervention that you've done in a community that, like, I'm thinking of your work in the Brownell Homes neighborhood. Can you tell us a little bit about one of those?
Yeah, so Brownell Homes, like, there's sort of the two styles of infrastructure improvements up there. Really, at the very beginning of my time with the CRIM, I was primarily working with this program called Safe Routes to School. Again, this is a truly federal money that is kind of trickled down, to use a rough term, to local agencies to try to, in a lot of it's really designed to build physical connections, literally sidewalks and bike lanes and paths between residences and their local schools, to increase rates of walking and biking and decrease rates of traffic and air pollution in neighborhood contexts within the city of Flint. Again, because of all of these rough economic and policy decisions that have been made in the past, big seismic shifts, a lot of our walking infrastructure, even neighborhoods like Brownell Homes, which are awesome, which are pretty stable, which have these great assets of schools in the middle of them and a neighborhood surrounded that support it, there are still major gaps in the existing infrastructure that, there were sidewalks, of course, for decades, but they have started to crumble, or they just weren't maintained, or properties were abandoned and no one took care of them, and so it just, after a long time, it often isn't a sidewalk there anymore, or it's in rough shape, or all these things. So we just did about a year of engagement to try to figure out how to best use this source, to figure out not just which paths could get the most kids safely to school, but which path options could get the most people to the neighborhood kind of corner stores, to the bus stops, right? These were outcomes that weren't built into the Safe Routes to School process, right? We had to be really kind of creative with our engagement and our narrative, but the result was a rebuilding of existing infrastructure in a way that I believe is having a pretty big impact on people's ability to access some things that are important to them on a day-to-day basis, like education, recreation, each other, right, socially, and transit and shopping. But another cool part of this is that we reestablished, right, a physical connection between the basically eastern side of the Brownell Homes campus to that whole section of the neighborhood by just putting in a new path. We very rarely build brand new infrastructure. It's almost always replacement or updating of existing stuff. But there was one section where there had been kind of an entryway to the play fields, the ball fields, when schools were still built. And we were able to do lots of engagement with the folks on that part of the neighborhood, who for the last decade or so had to take this really strange path if they wanted to walk to school to kind of get there, when there truly was a quick shortcut that we were able to use this kind of vacant space and really a small amount of this large infrastructure budget to build this direct shortcut connection between truly one half of the neighborhood, the original enrollment area of the school, and the front door of both Brownell Elementary School and Holmes STEM Academy.
Yeah, that's an interesting point. And just for the sake of time, I want to segue us over to a couple of concluding thoughts that I know Sam will have maybe to bridge this, because it speaks to the issue of quality green space, right? So we've been talking about vacant properties, and even when they're maintained, and like there's a park, but can you get into it? Can you get through it to a place that you want to go? So I'm gonna throw up our slides while Sam. I'm gonna skip over a couple things we were gonna, and maybe go to this one.
We can just mention it really quick.
Yeah. All right, so I'm going to share us again.
So we just wanted to really quickly talk about some of the amazing work that's been found on the health effects and the effects on crime of these greening programs, of especially Clean and Green. And we'll just mention actually really quick, if I can you go back slide, Dick? Maybe not.
This one?
Back, or no, back.
Oh.
There, where'd it go? We were just gonna mention, there it is,
Oh,
Clean and Green, and you put a map in there. That
Oh,
looks
yeah,
good.
I did. Yeah.
Do you want to just like in 10
Sure.
seconds talk
Yeah.
about the amazing effects of Clean and Green?
Yeah, so, and because I guess we really didn't, and we heard the number of lots that are being maintained, but in some research that I had done a few years ago, we did also find that neighborhoods that had more consistent and more intense greening over time saw reductions in crime through that same time period.
Yeah.
And that's linked to a body of evidence that's growing in other cities as well.
Yeah, and on that note, there's been another program kind of a similar scale in Philadelphia, and they've, in addition to studying crime outcomes, have also studied a variety of health outcomes. And I just wanted to mention some of the really important effects of these kinds of greening programs on real life residents and real life health in the community. And that's that greening in Philadelphia, at least, and probably in Flint, but we'll have to wait and see, is associated with improved mental health, including a really large reduction in the number of participants who reported feeling depressed or feelings of worthlessness. These greening programs increase physical activity, they reduce stress, and they actually increase the use of the restored lots for relaxation and socialization, which I'm sure is one of the key benefits that we would expect to see here in Flint. And let's see, do we have 1 minute? We were also just going to mention
Please.
that, okay, there are so many kinds of really cool green space interventions that we think affect health. So there's these urban greening programs that we've spent a lot of time talking about. There are also interventions that create new parks or create new greenways. And these kinds of interventions are pretty popular in other states. There's been a lot of research evaluation of these kinds of intervention in places like California, but a little bit less in Michigan. And we just wanted to highlight that as really a research opportunity, because understanding how these different programs, urban greening, park-based programs, greenway programs, how they affect health among residents is so important for figuring out how to optimize access, to increase health equity, and to really make sure that we're continuing to get Cade's word there, the trickle down effect of federal spending or of other public spending, so that we can keep investing in these kinds of programs. And so just moving forward, we'll end on this. Dick and I are really excited to continue doing this kind of evaluation work, figuring out how changes to green space and changes to other kinds of built and natural environments, like Cade was talking about, like Renetta was talking about, how those kinds of changes affect residents' health in Flint. Fortunately, there's a ton of projects like this going on in Flint, which creates a really amazing opportunity for research, for people like us to be able to do what are called natural experiments. So if you think about an experiment that takes place in a lab, that kind of information is really helpful to figure out whether, variable A causes, outcome B to, have a causal relation, but it doesn't tell us much about how those effects play out in the context of real life. And so natural experiments are things that sort of take experiments that are in the lab and they're occurring naturally. So there's been a variety of changes to green space, like Clean and Green, and also we're excited about the new state park that's coming to Flint that maybe many of you have heard about. Dick, do you want to just do a quick hype video on the new state park?
Yeah, so if you haven't heard, the old Chevrolet plant, what we call Chevy in the Hole, if you haven't been out there recently, you should definitely go out in between, Tenacity Brewing and Kettering, basically out toward Chevrolet. It's a massive park now. It's part of the county park system and very soon transitioning fully into being a state park. And so they put a vegetative cap on top of a big concrete pad that used to have a bunch of factories on it. And now it's a park and there's native grasses and there's going to be a lot more active programming. And the state park will be connected everything from Mott Park, which is a disc golf course now and has a new clubhouse and a hockey rink, all the way through downtown all the way up toward the Vietnam Veterans Park, north of the old farmers market, and then down a greenway going down into the Lincoln Park neighborhood to the south. And so it's the first state park in Genesee County, in fact, but it's going to provide a lot of resources. It could precipitate a lot of new investment. We also are concerned with making sure that that investment is equitable and offers a chance for people of different incomes to live near that park
Absolutely.
and recreate. So that's going to be a part of this work that we want to be doing, is seeing how does this impact people who already live here? How does it bring people into the community? Are the benefits equitable? Or, you know, especially because it's right through that middle belt of the city again, you know, are there connections being built up DuPont and King and Clio, connecting other parts of the city to it? So it's going to be something that we can study for many years to come.
Dick and Sam, thank you so much for all that wonderful expertise. I want to remind people too about the Healthy Flint Research Coordinating Center abstract dates and time. Deadline has been extended to August 7th. Dick and Sam, that was such wonderful research and such wonderful information. We know that lack of green space also potentiates childhood obesity and all of the other things, right? Kids need safe spaces to play. People need safe places to go and walk. Thank you so much for that wonderful expertise. We're so excited to hear from you. Looking forward to seeing you next week. Don't forget about your CE units for community health workers.